Hi, I'm Dr. Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is asymmetric breast causes and treatment. 99.9% of women and men are asymmetric in their breast. It's the degree of genetically, not that they are or aren't. I have had the fortune of enhancing breasts in several women that have been in magazines. And when they show me their pictures, they look much better than they do with unretouched photos. Why? They were formerly airbrushed and now photoshopped. Those women and men don't exist. They're put on a higher pedestal because they look good, but only through technology do they achieve that look. So, why do we have asymmetric breasts? Why do we have asymmetric parts of our body? Well, when the sperm hits the egg, we start to develop. The cells multiply, and then we form like a clamshell, and they come together like this, with the upper tube being our mouth and the lower tube being our anus. And what happens is there may be early asymmetric multiplication of the tissues, allowing asymmetry. For instance, when I was in high school, I could dunk with my left hand, but I couldn't dunk with my right hand. And it wasn't until I noticed when I got my first suit that was custom made that my left arm was an inch longer than my right arm. So, the same thing with women and men. We may have one breast develop more or less. So, it's not an abnormality, it is actually just a variation like a curve. Where you have a normal curve, you'll have symmetry, you'll have asymmetry, and you have max asymmetry. So how do we address these issues? Well, it all depends on what the woman or man wants. In a man, we usually just do liposuction to get them symmetrical. In a woman, we have options. One, on the larger size, we can do a breast reduction, or we can do an augmentation, or we can do a bilateral augmentation with a larger breast implant on the smaller size. Sometimes there's the difference in the nipple areolar size, so we can decrease that to make them equal. That's called a peri-realar nipple areolar complex symmetry operation. So we can also do a lift. Sometimes one breast will go down and one will be pointing forward. We go ahead then and do a unilateral mastopexy or a bilateral. Now, volume. If you have enough breast tissue, we will use a saline implant. Why? That can be adjusted intraoperatively to get a more exact shape. If you want a silicone breast implant, we have different sizers that we have you try on. And we call it the rice trick, where you go and get some rice, put it in a measuring cup, 1 ounce is equal 30 cc's, and then you'll put that small amount of rice in a nylon and put it in your bra. Make the straps equal, bend over, and the gaposis should be the same. Now we know approximately where you would like to be. We do this often in lumpectomies also. So, why do we get asymmetries? The vast majority are genetic. The next can be acquired after surgery. So there are options. Yes, it's more trickier to try to get people symmetrical. I tell people often, I can make sisters, not twins. But anyway, we go ahead and want to achieve twins, but often it's impossible there. But nothing is totally impossible. My goal is to put you into a bathing suit, a bra, a wet t-shirt, and no one should notice asymmetry or the scars. So, if you have asymmetries or you want to learn more about our treatment options, please, let's talk.